Bang, bang. We're back. Dr. Glover, your favorite gastroenterologist out in Las Vegas, Nevada. It's actually snowing here in Las Vegas today. That's crazy. Almost as crazy as the fact that half the world, 1 in every 2 people, unknowingly are infected with a bacteria that causes gastric ulcers, gastric cancer, small bowel lymphoma, iron deficiency anemia, thrombocytopenia, low platelets. Everyone always asks, what is going to be the smoking of our generation? I think there's a very strong argument to be made for this infection called H. pylori, Helicobacter pylori. I diagnosed 3 patients in clinic this week, diagnose it every week. Let's go ahead and start with a couple TikTok patient experience videos that I found describing symptoms, treatment, antibiotic side effects.
I just wanted to show you my stomach after taking like the medication and stuff. Look at that. I used to be like out here. I used to look pregnant, and anything I did, I mean, I have a mom pouch because 2 kids, but nothing I did. Eating right, eating smaller portions, intermediate fasting, running, going on my bike, nothing helped me lose weight.
I think she means intermittent fasting.
I was like stuck. I think I was at like 145. I was stuck like for years. And now when I started the H. pylori treatment, I'm down to 138, and I've actually started to see like results. So if you guys have bad breath, abdominal pain up here on your lower abdomen, burning pain, nausea, fatigue, it feels like there's holes like in your stomach, or like when you ate and then like an hour later you're starving, or when you're like not eating, your stomach feels like it's freaking like it needs food that like you've never eaten, you might have H. pylori. Go get tested.
Definitely the clinical manifestations of H. pylori are protean and myriad. We see all sorts of things: nausea, vomiting, fatigue from anemia, ulcers, dyspepsia, early satiety, meaning you feel full with just a couple bites of food. It causes all sorts of strange clinical manifestations.
The bad breath, my shit was kicked in, okay? If your breath is not coming from like your teeth or your tongue and it's coming internally, you need to go get tested. It could be anything else, but like your gut health is so important to your overall health and well-being of your entire body that you need to go get tested for H. pylori. Another thing
This is true. I don't think a lot of people realize we have more bacteria in our GI tracts than we have human cells in our body. We're literally more bacteria than we are human. So whenever there's any kind of disruption to that microbiome, you have H. pylori, you get another kind of infection like food poisoning, COVID, the flu, you take antibiotics. That's like dropping a nuclear bomb on your microbiome.
It was a lot of anxiety. I couldn't even drink coffee, and before, like I would drink 2 cups of coffee a day and I would be fine. I could not drink even 2 or 3 sips
She definitely seems to have a lot of coffee this morning.
of my coffee, and that sucks because I love the taste, so if you have bad breath. Oh, and my stools, it would go from me being constipated to having diarrhea to having, they call it pencil stools because they're so thin. Like I was just so all over the place, Now that I'm on, I think this is day 9 of my antibiotics, those first 8 days were horrible. I was just complaining yesterday about the pain. Today I feel good. I feel like myself. I feel like finally, this is like what it was. I was messing everything up, I feel like I finally got some answers, so.
The antibiotic regimens are fairly nasty. They have to be because it's a very resistant organism. It's usually 3 or 4 drugs for 2 weeks. We have names like triple therapy for the 3 drugs, quadruple therapy for the 4 drugs, but they cause a lot of nausea, vomiting, diarrhea. But the point is that if you don't take the full course of the antibiotics, it is highly unlikely that the H. pylori is going to be eradicated. So whatever you do, tough it out, take some antiemetics, but do your best to finish the full 14 days.
I'm glad. As I keep pushing for people to that's why I keep pushing H. pylori down people's throats and stuff because it's like, it's serious. It leads to ulcers and it leads to stomach cancer if it's not treated right, you know? So please guys, go get tested. Stool test, a breath test, so they can diagnose you. They're also good.
There are 3 ways to get tested for H. pylori. Number 1, like she said, is the Urea Breath test. This tests for the enzyme that the H. pylori produces in your stomach called urease. Number 2 is a stool antigen test. It looks for the H. pylori in your stool. Or finally, you can do an upper endoscopy with biopsies and they could see it under the microscope. And we'll show you that in a second.
I'm also like finding energy, like that natural energy, because I had to give up coffee. I'm on, I think, 3 weeks of no caffeine. And at first I was like, how the hell am I going to do this? But honestly, like I'm finding like that inner energy and it feels so good. I rode my bike today. I took a class today and later today I'm going to go take 2 more classes. And I feel like incorporating the exercise into like all of this treatment is helping me get through it because the last treatment, this is my second treatment that I've done for H. pylori. The last treatment was a quadruple antibiotic and I was nauseous. I wanted to throw up. I was throwing up. Yes. I was throwing up. Yes. I was throwing up. I had headaches. I had fatigue.
I usually give my patients an empiric antiemetic like Zofran to help with the inevitable nausea, vomiting that goes along with the H. pylori antibiotic regimen for this very reason.
I get out of bed, so depressed. I was getting panic attacks. I would take the medication and 15 minutes later, panic attack. And it's like, it's the medication that's doing this? So I lasted probably 5 days doing that. After that, I felt really good. And I was like, okay, maybe I'll just maintain eating healthy, smaller portions, not just not on things. And then it came back harder. So now it's my second time, and I feel like pretty confident that it's gonna be gone. And if it's not gone,
she mentions that it came back harder. It is infinitely more likely that the first regimen simply didn't work. The chance that you're reinfected as an adult approaches 0. Most of the time, H. pylori is acquired in childhood when you're 2, 3, 4 years old. That's because your immune system as a child is not as mature as when you are an adult. So when we find it in an adult, it's not that they got infected as an adult, but it's been laying dormant for all these decades. You've had it when you were young and it just went undiagnosed. We talked about why it's important to diagnose not just for symptoms, the nausea, vomiting, early satiety. It can cause anemia, low platelets and bleeding, thrombocytopenia, gastric, small bowel cancers. It needs to be treated for all those reasons.
I know what to do now. Huh? You want to get in the shower?
All right. So I want to show you something very interesting here, and that is, like most things in medicine, the evidence and the literature was always behind. So take a look at this slide here. The yellow is your gastric cells, your stomach cells. This is from a biopsy during an upper endoscopy when they take a piece of gastric tissue. Pay attention to all these black dots surrounding the gastric cells. For decades, the pathologist, the doctor who looks at the biopsies under the microscope, thought that these black dots were dust or dirt on the slide. It was only when these 2 gentlemen, 2 Australian physicians, were convinced that it's not dirt, these are bacteria. No one would believe them. So this gentleman here, Barry Marshall, to prove his point, actually intentionally ingested H. pylori and then did an endoscopy proving that the H. pylori caused ulcers in he himself, and for that they won the Nobel Prize in 2005. I think it goes to show how the literature and evidence-based medicine is always behind anecdotal evidence, and it takes a real pioneer to convince the medical community of something like H. pylori. Let's take another look at this video here. It's Evelyn. Let's share her experience.
With some results that I finally got. So as you guys know, I've been nauseous for almost 2 years straight. I stopped counting after a while. But for the past 2 years straight nauseous, right? Now, mind you, it's been going on for 10 years on and off. And so long story short, I got a colonoscopy and endoscopy done. Colonoscopy results negative. endoscopy biopsy from my stomach came back positive with the bacteria H. pylori. That's what I have, a whole infection in my stomach. H. pylori is a bacteria that like destroys the lining of the stomach, which once that's like damaged, you know, you feel burning sensation, you feel nauseous, everything that I've been feeling. It also causes ulcers and can lead to, it's a high risk and can lead, if not treated, can lead to stomach cancer. So praise the...
Like we talked about, not just stomach cancer, but also small bowel lymphoma that can be fatal.
The Lord, I finally found it. I kept going after for many, many, many years. And finally, I got the biopsy done, which the doctor wasn't really a fan of it. He wasn't trying to do it anyways. He was like, oh, this is probably has to do with your ankylosing spondylitis. Like that's what's making you nauseous, because that autoimmune disease also is affecting all of my organs, right? So they're not working properly like that.
Ankylosing spondylitis affects the spine. It should have nothing to do with nausea.
Yes, they are, in Jesus' name. So we get the results back. That's what it is. And I've been on treatment for a couple of days now. It's for 14 days straight. 8 pills a day is what I'm taking. So we'll do the breathalyzer test in a couple months to see if the bacteria is still active. If so, repeat treatment. If not...
She brings up an important point, and that is, we talked about how treatment should always be done with either triple or preferably quadruple therapy, 4 drugs for 2 weeks. It's very important. It's imperative that you get a test of cure 3 to 6 months after treatment. This is because oftentimes, if the antibiotics fail, you need to know. And when you retreat, if you do need to retreat, don't use the same antibiotic regimen. If it didn't work the first time, it's not going to work the second time.
Then I'll be free from it. So that's what caused me to lose dramatic weight amount within like 1 week, 30 pounds. Been nauseous nonstop, you know, no appetite. I'll grab a plate, I'll take a couple bites, and I'll be full. But yeah, I finally found out what it was, H. pylori, and I rebuke it in the name of Jesus. But I'm really happy that I finally found the issue. And I just wanted to update you guys that I finally found out what it was. Oh.
Let's take a look at a couple of the comments here. This user says, drink probiotics during and after treatment. Definitely do not drink probiotics during treatment. The antibiotics are already wreaking havoc and killing your microbiome. They're just going to kill the probiotics that you take. Furthermore, the probiotics may impair the efficacy of the antibiotics that you're taking, making it more likely that the H. pylori will not be fully eradicated. You can take it after. Don't take them during. Anna says, I was on antibiotics. I did the breath exam after a few months. And a few weeks ago, I was negative. Like we talked about, you can be tested with either urea breath test, stool antigen, or an upper endoscopy with biopsies. But that bacteria caused me chronic active gastritis. I'm still so nauseous. I lost weight. I feel weak. My digestion is all messed up. In many of my patients, it takes a couple weeks to months to fully re-equilibrate and heal your microbiome, not just from the H. pylori that was eradicated, but also from the damage that the antibiotics do. We only use them if we have to. Ann says, I'm on day 10 of treatment, taking 13 pills a day. It's rough, but I'm praying for a relief soon. My pharmacist told me not to take probiotics until I'm done with treatment, since antibiotics will kill the good bacteria and it's a waste. I agree with that. Izzy said, Mom passed away from H. pylori. Stomach cancer is no joke. It definitely is a real deal. Most of the time when we find gastric cancer, not always, but most of the time it is associated with H. pylori. So in summary, in my opinion, as a GI doctor out here in Las Vegas, I think H. pylori is going to be up there with the smoking equivalent for our age. It's the most underdiagnosed chronic infection of mankind, secondary to maybe dental caries. It's crazy that half the world is infected, and the majority of those people who are infected have no idea. If left untreated, and people usually acquire it when they're 3, 4, 5 years old, and it goes undiagnosed for decades, it can cause gastric cancer, small bowel lymphoma, gastric ulcers, iron deficiency anemia, low platelets, thrombocytopenia that can cause bleeding, nausea, vomiting, early satiety. We typically treat it with either triple or quadruple therapy. The drugs are nasty, but it's necessary because it's a very resistant bacteria. Take the full course regardless of any symptoms that you may have, because if you don't take the full 14 days, if you take only a couple days, you miss doses, you only take a week, it's not going to work. Make sure you get that test of cure to make sure it was eradicated. It's also true that H. pylori is contagious. This sounds gross, but it's fecal oral and things are not as clean as they seem. So whenever I see a patient in clinic that has H. pylori, I tell them, significant other, your parents, your kids, make sure that they're all tested as well. Another point I want to make, and we'll go in more depth here, how does that urea breath test work? Well, the bacteria that lives in your stomach, the H. pylori, produces an enzyme called urease. This turns ammonia into ammonium, raising the pH, decreasing the acidity, allowing the bacteria to develop a chronic infection in your stomach. When you do the urea breath test, you take radioactive urea that is metabolized by the H. pylori urease, and this is what results in the positive test. Of course, alternatives like we talked about is the stool antigen or an upper endoscopy with biopsies. I wanted to share because I am fairly convinced that this is the most underappreciated GI condition. I diagnose it every week. If you have any of those symptoms, go get tested in the way that we discussed. If you or any of your loved ones had H. pylori or having similar symptoms or experiences, I appreciate any comments. I appreciate you taking the time to watch. Otherwise, I will see you in the next one.